Vijaya. Well, good afternoon, everyone. I know that Islanders have been waiting anxiously for an update today after hearing about the new cases of COVID-19 over the last 2 days. Since yesterday, we've had thousands of young Islanders in the Greater Summerside area do their part in helping to contain this outbreak as quickly as possible. At the Three Oaks Senior High School asymptomatic clinic, we've tested over 880 Islanders using rapid tests. That's as of 3 o'clock today. And our lab has processed over 1,000 PCR tests today alone. Thanks to all of those who stepped up today to do their part. You're doing it not just for yourself, but your community and your province, and that is something that all Islanders are grateful for. As a result of our aggressive testing, Dr. Morrison will soon be sharing with you that we have a number of new cases today. We will further expand our testing protocols tomorrow, and she will be providing specific instructions for Islanders in the next few days. We've been through this before, admittedly under different circumstances. On one hand, we have over 7,000 Islanders vaccinated as of now. But we also have the struggle of now having to presume that any new positive that pops up in PEI could be a variant of this virus. In the past, when we have faced a similar situation, we followed the advice of Dr. Morrison in the Chief Public Health Office. That advice being to go hard and to go fast, and in doing so with those actions, hopefully to get through this bump in the road as fast as possible. So for that reason, we'll be introducing another province-wide circuit break. We need to wrap our arms around this virus and prevent it from spreading to the full extent that we can. We will learn from the past experiences that we have had as well as others. We will continue to ask people to stay apart as much as possible, while at the same time being as active socially and physically as possible, because we have learned over time how important both those aspects are to our overall well-being. So with that, I will turn it over to Dr. Morrison to provide further details, and then we will open the line up to questions from our friends in the media. So over to you, Dr. Morrison.
Thank you, Premier. Good afternoon, and thank you for attending this unscheduled COVID-19 briefing on a beautiful winter day here in PEI. Yesterday, I did commit to providing an update on the COVID-19 outbreak currently underway in PEI, and I'll also discuss some measures around testing, as well as additional exposure notifications and some details of the new circuit breaker measures. Today, there are 6 new cases of COVID-19 to report in PEI for a total of 14 new cases in the last 4 days. All of the cases are now self-isolating and will be followed daily by public health. 5 of the new cases are linked to previously announced cases. We have 15 active cases in total in PEI, and over 150 people have been identified as close contacts. And the number of close contacts will increase as our contact tracing efforts continue even this evening. To date, we have not been able to identify a travel connection with 12 of the 14 cases announced since Wednesday. I noted yesterday that I was worried about the number of new cases in PEI and the fact to date we cannot link this outbreak to travel outside of PEI. Today, I am still worried. Testing is the key to identifying how much COVID-19 is circulating in our province. Testing of people with and without symptoms will tell us the prevalence of the virus and just what we are dealing with, and help us curb the spread of COVID-19. We are recommending that anyone with any symptoms of COVID-19 to please be tested, and the list of available clinics is on the website. Yesterday, we announced a targeted testing strategy for youth in the Summerside area aged 14 to 29 with no symptoms of COVID-19 to be done and tested at Three Oaks High School. This morning, youth aged 14 to 21 who have birthdays between January and June were tested between 8 a.m. and 2 p.m. Youth aged 14 to 21 who were born between July 1st and December 31st were tested this afternoon. Tomorrow, Sunday, it is strongly recommended that youth in the Summerside area aged 22 to 29 be tested at the Three Oaks High School as follows. If you were born between January 1st and June 30th, you should present for testing between 8 a.m. and 2 p.m., and if you were born between July 1st and January 31st, you should be tested between 2 p.m. and 8 p.m. I will note that if there are young people who are in that 14 to 21 age group who were not tested today, please feel free to also go to the Three Oaks Clinic tomorrow as well. And anyone with symptoms of COVID-19 should go to the Slemon Park Testing Clinic. The Slemon Park Clinic is open until 8 p.m. this evening and reopens at 8 a.m. tomorrow. As the Premier mentioned, young people in the Summerside area have listened to and heard the appeal to be tested, and young people in the Summerside area are responding to the opportunity to be tested. As he mentioned, as of 3:30 p.m., there were almost 1,000 tests done today at the Three Oaks Testing Clinic. And in addition, there have been 1,000 tests analyzed by the provincial laboratory. So thank you for your support and for caring about your health and the health of your loved ones and friends. There are additional public exposures related to the new cases. Individuals who are at any of the following locations on the specified dates and times should immediately self-isolate and then be tested for COVID-19. Following their initial negative test, individuals will not need to continue self-isolating. However, they do need to be vigilant in monitoring themselves closely for symptoms and be tested if they develop any symptoms at all. The public notifications are as follows. The Pita Pit in Summerside, Friday, February 19th, between 11 a.m. and 9 p.m. Sunday, February 21st, between 11 a.m. and 7 p.m. Monday, February 22nd, between 12 noon and 9 p.m. Tuesday, February 23rd, between 12 noon and 9 p.m. Wednesday, February 24th, between 2 p.m. and 4 p.m. And Friday, February 26th, between 8 a.m. and 2 p.m. Callbacks Home Hardware in Summerside, between 8 a.m. and 5 p.m. on the following dates: February 16th, 18th, 19th, 20th, 22nd, and 25th. Burger King in Summerside on Granville Street, Sunday, February 14th, between 11 a.m. and 5 p.m. Wednesday, February 17th, between 8 a.m. and 3 p.m. Thursday, February 18th, between 8 a.m. and 2 p.m. Saturday, February 20th, between 8 a.m. and 3 p.m. Sunday, February 21st, between 11 a.m. and 5 p.m. Monday, February 22nd, between 8 a.m. and 2 p.m. Wednesday, February 24th, between 8 a.m. and 2 p.m. And Thursday, February 25th, between 8 a.m. and 3 p.m. And Domino's Pizza in Summerside, additional notifications: Wednesday, February 17th, between 4 p.m. and 7 p.m., and Monday, February 22nd, between 4 p.m. and 11 p.m., Tuesday, February 23rd, between 4 p.m. and 1 a.m., and Wednesday, February 24th, between 4 p.m. and 1 a.m. I know there are other public notifications that we've mentioned in the last couple of days posted on our website, and these include other locations such as the Breakfast Spot in Summerside, the Taste of India in Charlottetown, and Domino's Pizza in Summerside. And anyone who was at any of these locations in the last 2 weeks is asked to check out the notifications and look at the times and dates, and if necessary, be tested for COVID-19. Throughout this pandemic, we have balanced the need to protect the most vulnerable with protecting our health system, with opportunities for workplaces, schools, families, and the entire province to function in COVID-safe ways. As a province, our COVID-19 situation has changed significantly over the last 3 days. On Tuesday, we had 1 active case, and as of 3 p.m. today, we have 15 active cases. As this outbreak continues to evolve in the coming days, we are expecting to receive more positive cases. This outbreak is likely going to get worse before it begins to get better. In order to interrupt the chain of transmission and allow us time to get the current outbreak under control, Effective tomorrow, Sunday, February 28th at 8 a.m., and ending on March 14th, we will be instituting circuit breaker measures as follows. Personal gatherings will continue to be your household, plus a maximum of 10 consistent individuals. And we emphasize the word consistent, and this is really where you want to keep your circle of contacts small. Organized gatherings will be limited to 50 people for concerts, worship services, and movies. There will be no additional cohorts permitted. Weddings and funerals will continue to be up to 50 people plus officiants, and no wedding or funeral receptions are permitted. Supervised gyms and fitness facilities can operate at up to 50% of standard operating capacity with additional cleaning. Museums and libraries can operate at up to 50% capacity. Individual and team practices are permitted in accordance with gathering limits. Games, tournaments, and competitions are not permitted. Retail stores, market, and craft fairs can operate at 50% of standard operating capacity, provided entrances and exits are monitored. In-room dining is not permitted. Takeout and delivery are permitted. Personal services may operate on an appointment basis, provided a non-medical mask is worn at all times by staff and patrons. Child care centers can continue to operate at full capacity, and for long-term care, there will continue to be the 3 partners in care and designated visitors. These circuit breaker measures will be available on the provincial website soon. As we have done in the past, we will continually assess the COVID-19 situation in PEI. If we can safely ease these measures before March 14th, we will absolutely consider doing that. If these measures are not effective in breaking the chain of transmission of COVID-19, and we are not able to get this outbreak under control, we will consider increasing the restrictions. I know these circuit breaker measures are not what people want to hear. We are all feeling COVID weary. And since the pandemic began, there's never been a time where islanders have been more at risk of suffering serious consequences of COVID-19. Now, more than ever, we need to be resolute in our fight against COVID-19. And the end is certainly in sight, but we need to hang on for a couple more months. If you are wondering what you can do, I would suggest, if you are a business or organization and are required to keep records of names and contact information for patrons, attendees, or staff, you can help us to help you by ensuring these records are accurate, complete, easy to read, and readily accessible. Contact lists should be updated regularly and at least weekly. Readily available and accurate contact information supports more efficient and timely contact tracing. Please take time to ensure that your contact lists are current and complete, and that it would include staff lists. Secondly, individual islanders can help to contain the spread of COVID-19 by respecting the public health measures put in place. It is important that we all keep our circle of contacts small, stay 6 feet apart from people outside our household, wash our hands often, wear a mask in public spaces, stay home from work if we are not feeling well, avoid non-essential travel. And if you don't have to do something, make the choice to stay home. Lastly, if you have any symptoms of COVID-19, please arrange to be tested and isolate until your results come back. This is a challenging time for all islanders. Today is a hard day, and this is not the news we want to hear, and it's definitely not the news we want to be sharing with islanders. As we have in the past, we will get through this rough patch, and we'll get through this outbreak by working together and supporting one another. We've said that this is really a social virus in many ways, and so we need to work together to decrease our social contacts in order to try to manage it. Our focus will continue to be on containing the spread of the virus with self-isolation, early identification of cases, contact tracing, the quarantine of both cases and close contacts, and we will be completing our comprehensive contact tracing of all our cases. As I mentioned, there are currently at least 150 people in self-isolation in PEI, and being diagnosed with COVID-19 or being named as a close contact is very difficult for many people. As friends and neighbors, it is our role to support them. In many cases, they got COVID-19 as a result of going about their daily routine. If you know someone in self-isolation, please reach out to them virtually to offer your support. If you drop something off to them, please do it from a distance. The best option is to leave the package or a card at their front door. As we double down our efforts to limit further spread of COVID-19 in our beautiful province, please continue to be patient and kind. Thank you.
Thank you very much, Dr. Morrison. And just before we go to the questions from the media, it does bear reminding that, the individuals on the front line of our health here, be they those who are doing the testing, those doing the contact tracing, those working in the lab, really are tremendous heroes doing amazing work, turning things around at an incredible pace. And they went into this weekend knowing they were going to be working, extra hard, and they're doing so. They're doing a great job, and I just wanted to pass along my thanks and the gratitude of all Islanders for that. So with that, I will turn it over to questions from our friends in the media.
Sally Pitt, CBC.
Hi, Dr. Morrison, Premier King. Thanks for providing this update today. I'm wondering, Dr. Morrison, if you can provide some more details about the 6 new cases, whether they're linked. You said they were linked to one previously announced case, so I'm just wondering if that is one of the cases in Summerside, one of the cases in Charlottetown. If you could explain a little bit about that, their age, gender, that circumstances of how they might have got this.
Thanks, Sally. And sorry, I should have mentioned the 6 new cases. All are individuals in their 20s. 5 are males and 1 female. And at this point in time, we know that 5 have some link to the 3 positive cases that we had announced in Summerside yesterday. It feels like a long time ago, but I think it was just yesterday morning. And so there is some link to them as either close contacts or contacts of the contact.
Okay, and what you said that there were, I believe it was 1,000 tests done today, and we know that you were trying to get in touch with the close contacts of the previously announced positive cases. What can you say about the tests that have come back so far for the close contacts and the other people who've been tested so far?
So we're certainly working through a number of the close contacts. So many of the close contacts have been negative. Of course, starting this morning, we had 4 of them as close contacts initially come back positive. We are still having other close contacts from the cases yesterday that are in the lab and are pending. So I don't have all the close contacts back. And of course, with each new case, we add more close contacts. And so that list continues to grow, but certainly the majority of the close contacts have come back negative. But it's important to note that close contacts, even if they're negative tests, they still remain in isolation if you're named as a close contact for that period of time. And that may be that your exposure happened 2 days ago, you get tested today, it may be too early. You may not show positive today, but that's why you need to stay in self-isolation, because you may turn positive at some point during the 14 days after the exposure. And so that's just worth mentioning.
Thank you.
Laurent Rigaud, La Voix.
Bonjour, Dr Morrison. Good afternoon, Mr. King. J'ai une question en français. Est-ce que vous pouvez déjà réexpliquer en français ce qui va se passer pour les 2 prochaines semaines, s'il vous plaît?
Bonjour, Laurent. Oui. Alors, commençons demain matin à 8 heures le matin. On va avoir un circuit breaker et puis on va garder le même nombre de personnes pour être ensemble avec les familles. C'est la household, la famille avec un maximum à 10 personnes, mais c'est les mêmes 10 personnes. Alors, il faut garder quand même vos contacts le plus petit que possible. Les autres qui sont plus organisés, le maximum est 50 personnes pour l'église, pour les concerts. Même chose pour les funérailles. Et puis, ils n'ont pas le permis d'avoir les réceptions pour les mariages ou les funérailles. Et puis, pour beaucoup les magasins, les gymnases où il faut faire les fitness, c'est un maximum 50% capacité. Et puis, vous n'êtes pas permettre de manger en dedans les restos. C'est seulement, il faut take-out ou delivery. Et puis, je pense que ça, c'est les grandes choses qui vont changer pendant les 2 semaines. Mais si on voit des choses qui s'améliorent, on peut changer. Et puis, si ça ne va pas pendant les 2 semaines, on peut être même plus strict.
Merci. Et j'ai une question sur le nombre de cas actifs. Je suis désolée, j'ai peut-être pas compris tout à fait ce que vous avez dit en anglais. Il y a 6 nouveaux cas aujourd'hui. Il y en avait 6 actifs, je crois, hier. Et vous dites qu'il y en a 14 en tout. Est-ce que vous pouvez nous réexpliquer, s'il vous plaît?
OK. Alors, on a 6 nouveaux aujourd'hui, mais on a eu 14 dans les dans les derniers 4 jours. Et mardi, on avait seulement 1 actif. Et puis, on a ajouté 14 depuis 4 jours. Alors, en total, on a 15 actifs cas de COVID-19, mais on a 6 nouveaux aujourd'hui, mais on a eu 4 hier.
Merci beaucoup.
Nicola McLeod, CBC.
Hi, Dr. Morrison. What does it say to you that there's no obvious connection between the Summerside and Charlottetown cases?
Well, I think we're continuing to investigate any potential link between any and all of our cases, and that's really part of the contact tracing that goes on, and continuing as we get more cases and trying to put those links together and try to tie the pieces of the puzzle together, and so we're certainly wanting to piece those ties together and see what linkages may be there. But it's also really important that we continue to test and isolate people and minimize the spread. So we're sort of looking at all those aspects.
Thank you. And there's been a lot of public exposures, and so I guess I'm wondering, do you believe there'll be more public exposure notifications in the days to come? And how difficult has it been to reach everyone who may have been exposed to this point?
Well, I mean, most of these public exposures are named really out of an abundance of caution because the interactions are briefer. A lot of these public places have good operational plans and sometimes protective barriers, for instance. So it is certainly lower risk. And that's why it's really important that we do a lot of the close contacts. So I know that we list a number of these public exposures and really asking for testing, but also making sure that if anyone has symptoms at any time, whether or not they've been at these exposure sites or not, go get tested.
Thank you.
Logan McLean, The Guardian.
Good afternoon, Dr. Morrison. You said that people who were at the Burger King in Summerside would need to get tested. That restaurant is inside the Walmart in Summerside. Would customers and staff who were at the Walmart during those days also need to be tested?
No, it really, and that is again, just because we know where the person was in terms of where they were working at the Burger King, then it really would be not everyone. It would really be anyone who was just at the Burger King itself.
Okay. And the asymptomatic testing is happening at Three Oaks. Where exactly in the building is that happening, and what's being done to ensure that it will then be safe to go there afterwards for the students?
Well, so I haven't been up to Summerside today, but they worked out, they have the testing plan where they're coming in one way and out another way. They are, of course, using full personal protective equipment, and they're actually using the ID Now machines, which are molecular tests as opposed to the antigen tests, so they have a better sensitivity and specificity than some of the other tests. So we have, but I think it's that we do drive-through testing with PCR as well on a regular basis, as you know, and we've done these pop-up clinics in other locations and have used the ID Now machine at other sites. So I think they're pretty comfortable with not only how the testing happens, but also the cleaning protocol in place.
Great, thank you.
You're welcome.
Marielle Guimond, Radio-Canada.
Oui, je pense Marie-Ève Brassard. Je pense que c'est moi.
Oui, s'il vous plaît, annoncez.
Oui, merci. Oui, donc bonjour, Dr. Morrison. Ma question est pour vous. En fait, j'aimerais que vous m'expliquiez un peu en français qu'est-ce qui vous inquiète dans le fait qu'il n'y a pas de lien avec des voyages dans les 12 des 14 derniers cas recensés dans les 4 derniers jours.
Ça nous inquiète parce que la plupart des cas ici à l'île du Prince-Édouard, on peut voir c'est lié au voyage hors du province. Alors, si je m'inquiète parce que ça peut être le variant. Ça m'inquiète parce que on ne sait pas vraiment la source de l'infection et ça m'inquiète parce qu'à ce moment, je ne sais pas le nombre de personnes peut-être qui sont infectées et qui, et pour cette raison, qu'on encourage le test qu'on fait. Et puis aussi, c'est pour cette raison que on fait les mesures de circuit breaker pour réduire le risque pour les insulaires.
Merci.
Okay, merci.
Brett Bundall, Canadian Press. Brett Bundall, Canadian Press.
I apologize. Can you hear me? This is Brett Bundell with the Canadian Press.
Go ahead, Brett.
Thanks very much for taking my question. I was just wondering if you could perhaps sort of stand back for a minute and talk about just sort of the path that's led to today. I know things have been generally really very good on the island, and just sort of if this is a discouraging sign or if this was expected, and sort of how you anticipate to sort of move on from here. I know you're ushering in some new the new measures you talked about today, but just sort of if you could kind of speak a little bit more broadly about how the province will get past this, and if it's discouraging just given how positive things have been generally.
Well, I'll take the first part of that, Brett. I think it's anytime you face a decision such as this, it's with a great deal of difficulty that you undertake it. It's not something that we ever look forward to. I think it's discouraging from the perspective for all islanders simply because we've done very, very well to date. and we can see the finish line, but we do seem to be stuck in this tangled spider's web of COVID that it won't really let us firmly out of its grip. So that's a little bit discouraging, I think. But, you know, the reality is we aren't through it, and we have to make these decisions such as this because you know, when we've had some hiccups like this in the past, we've gone hard, we've gone fast, and that allows you to get through these a little bit more quickly, and that is certainly the hope and the design. So that's where we're at. I think, you know, Dr. Morrison can expand upon how we've gotten to here, but just over the last few days, we've had the initial cases that arrived with no direct link to travel. We've had these cases that have now been connected to those cases. We still haven't been able to identify that link, that source. We're treating this as if it is the variant. We don't know if it is, but we don't know if it isn't. And the way this seems to be acting, we're operating under the assumption that it is the variant. And therefore, we meet, and we've met over the last few days. Dr. Morrison hasn't slept any more than I have, I don't imagine, and I mean, here we are. You know, we're grateful that we have these results back simply because thousands of Islanders went out today and got tested. So for us to get through this, we need to know where the virus is, how widespread it is, and then we take our actions accordingly. So, yeah.
I agree. I think we have worked very hard as a province, Islanders, and as a whole, to make sure we have, you know, been as, you know, gotten through this far into the pandemic, getting close to a year now, and. But we also have to remember that we are in the middle of still a global pandemic, and there are cases in this country, in the world, and that we need to be prepared to manage this kind of situation when it happens. And we know that quicker we react to this kind of situation, then the easier and faster it will be to recover. So we'll look forward to getting over this little bump and moving forward.
Just one quick follow-up, if there's time. I realize you're introducing some measures starting as soon as tomorrow, and obviously the hope is that would bring things under control. But I'm wondering if there are other kind of measures that you've got in your back pocket that you may introduce. And I'm interested maybe in some, I know there's some essential or some workers that travel in and out of the province, and I'm wondering if you have any thoughts about where these cases that aren't connected to travel may be coming from, and if there's maybe some measures that could be introduced that might sort of stop potentially some gaps in what's otherwise seems like a pretty good sort of provincial firewall system?
Well, I mean, I think we have essential workers coming in and out because we actually need our essential workers to work, and also we need the supplies that come in and out. We actually have I think one of the things that has worked well for us, and we will continue, we're always looking at how we can make sure we tighten it up, but we do testing of our rotational workers at day 0 to 1, 4 to 6, 9 to 11. So we test frequently. We're also trying to make sure that anyone who is supposed to be tested is being tested. We are phoning them. We are also trying to make sure our truck drivers are tested. But we will continue to look at that and make sure that we aren't missing people that we should be testing, because that is a really important part of our process here, and it has served us very well.
And if I could just add, Brett, before we go, that, you know, I think both Dr. Morris and I have gotten lots of correspondence from Islanders, and, you know, a common question we get is, why do you continue to let those people in here? But I mean, the large variety of cases that we've had here in PEI have been Islanders, you know, returning home, and so no one knowingly brings this virus into the province. There wouldn't be an islander who comes in here that if they thought they had it, they would come and bring it here. But it just shows it's the nature and difficulty around this virus. We do have great firewalls, as you put it, in place. We do have great protocols that have allowed us to be as safe as we have been. But we knew from the beginning that it isn't perfect. We're trying to deal with a worldwide pandemic while at the same time keep some semblance of regular life, of a regular economy operating. And as an island province, that requires us to have our goods and services trucked into the province and out of the province. And it requires us in our health sector and other areas to have rotational workers that come and go and provide the services that we need here. So I'm grateful we've done a really, really good job to date, but there is always a measure of risk in this, and it's something we try hard every day to mitigate, but it's never perfect. So thank you very much. Thank you, Dr. Morrison, and we will provide updates as needed in the days ahead. Thank you.